In venovenous (VV) ECMO, recirculation is best described as a. Blood flowing from the pump back into the heater. B. Oxygenated blood from the return cannula being immediately pulled back into the drainage cannula. C. Blood leaking out of the circuit connectors. D. The reversal of blood flow through the heart. Answer: B. Oxygenated blood from the return cannula being immediately pulled back into the drainage cannula. Explanation: recirculation decreases the efficiency of VV-ECMO. It occurs when the drainage and return cannulae are too close together, causing the fresh blood to be sucked back into the machine instead of circulating through the patient's body. Which pressure reading reflects the resistance of the blood returning to the patient's body? A. Negative venous pressure. B. Premembrane pressure. C. Postmembrane, return, pressure. D. Delta P, delta P. Answer: C. Postmembrane, return, pressure. Explanation: Postmembrane pressure is the pressure of the blood after it leaves the oxygenator but before it enters the patient. An increase here usually indicates a kink or obstruction in the return cannula. What is the chatter or kicking of ECMO lines usually a sign of? A. The pump is spinning too fast for the available venous return, preload insufficiency. B. The oxygenator is failing. C. The patient is hypertensive. D. There is a hole in the tubing. Answer: A. The pump is spinning too fast for the available venous return, preload insufficiency. Explanation: line chatter happens when the drainage cannula intermittently sucks against the vessel wall due to low blood volume, hypovolemia, or excessive pump speed. When managing a patient on VA-ECMO, North-South syndrome, Harlequin syndrome, refers to A. Proper mixing of blood throughout the body. B. Upper body hypoxia while the lower body is well oxygenated. C. Lower body ischemia due to a large femoral cannula. D. Brain death despite cardiac recovery. Answer: B. Upper body hypoxia while the lower body is well oxygenated. Explanation: This occurs in VA-ECMO when the heart starts to recover and pumps deoxygenated blood from the lungs to the head/arms, while the ECMO provides oxygenated blood only to the lower body via the femoral artery. Which lab value is most commonly used to monitor the anticoagulation status of an ECMO patient in real time? A. INR. B. Activated clotting time, ACT. C. Platelet count. D. Fibrinogen. Answer: B. Activated clotting time, ACT. Explanation: ACT is used at the bedside because it provides rapid results, allowing clinicians to titrate heparin infusions to prevent circuit thrombosis. What is the bridge in an ECMO circuit used for? A. To transport the patient between hospitals. B. To bypass the oxygenator during a changeout or to recirculate the circuit during weaning. C. To connect two different ECMO machines together. D. To filter out inflammatory cytokines. Answer: B. To bypass the oxygenator during a changeout or to recirculate the circuit during weaning. Explanation: The bridge is a short piece of tubing connecting the arterial and venous limbs. It allows the circuit to remain active and the blood to move, preventing clots, while the patient is temporarily clamped off from the machine. Distal perfusion cannulas are specifically used in VA-ECMO to prevent which complication? A. Stroke. B. Pulmonary edema. C. Limb ischemia. D. Renal failure. Answer: C. Limb ischemia. Explanation: Large arterial cannulae in the femoral artery can block blood flow to the rest of the leg. A small distal perfusion cannula diverts some oxygenated blood down the leg to keep the limb alive. If the ECMO pump fails completely, power failure, what is the first manual action the specialist should take? A. Give a bolus of fluids. B. Use the manual hand crank. C. Call the surgeon. D. Turn up the oxygen sweep. Answer: B. Use the manual hand crank. Explanation: All ECMO pumps come with a manual hand crank. In the event of total electronic or motor failure, the specialist must manually spin the pump to maintain blood flow and prevent the blood from clotting in the circuit. In VV-ECMO, the sweep gas is usually 100% oxygen. What happens if you turn the sweep gas flow rate to 0? A. Oxygenation stays the same, but CO2 rises rapidly. B. The patient will stop breathing. C. The pump will stop spinning. D. The blood will turn bright red. Answer: A. Oxygenation stays the same, but CO2 rises rapidly. Explanation: without sweep gas flow, there is no gradient to remove CO2. This is often done intentionally during a trial off to see if the patient's own lungs can handle CO2 clearance. What is the primary risk of negative drainage pressure, suction, exceeding -60 to -100 mm of mercury? A. Hypertension. B. Hemolysis, destruction of red blood cells. C. The oxygenator will explode. D. Excessive oxygenation. Answer: B. Hemolysis, destruction of red blood cells. Explanation: excessive negative pressure causes mechanical trauma to red blood cells, leading to hemolysis, which can cause kidney damage and anemia.